My name is Molly. I'm a Bellarmine nursing student, and today I'm going to be doing med prep for my patient, George Jackson. Form hand hygiene. When I first go into the room, I am checking that I have the correct patient drawer against my medical record, and this is George Jackson, and his medical record number is correct, so I have the correct patient. I'm going to now do my first check of MAR. Okay. So the first medication that George Jackson has is hepatitis B, and this is correct, and it is 0.02 milliliters, and that's the correct concentration. It's going to be 1 milliliter of hepatitis B. That's the dose. The route, intramuscular. It's given once daily and is still active, so it has not yet been given, and the time is 800. The second medicine I'm going to check is insulin. I'm checking that this is regular insulin, and it's of 100 units, so that's correct. The dose is going to be based off of my patient's blood glucose level, which is seen in his vitals. It is 323. So the dose that will be given is 8 units. The time it's active, and the time is 0800. I'm next going to be giving furosemide, and that is correct. It is a 20 milligram oral tablet, so that's the correct dosage. The route is by mouth, and the frequency is daily. Status is active, so it needs to be given at 0800. And then we have the fourth medication, which is panoperazine, which is 40 milligrams by mouth, 1 tablet. And the time is active, 0800. I'm now going to prepare my medications, and I'm going to start with the PO. So while preparing my medications, I'm going to make sure that it once again is the correct medication, the correct dose, and this package is sealed and the expiration date is fine. And then going to do the same. It's the correct medication, the correct dosage, it's an oral tablet, it's sealed and not expired. Okay. I'm then going to start by preparing my hepatitis B. This is Hep B. I'm going to use a 3 milliliter syringe, and I'm going to use a 1-inch needle, which is based off my patient's weight, which is 224 pounds. I'm going to start by cleaning the vial. So because 1 milliliter is going to be given, I'm going to draw up 1 milliliter up here. Inject that into my vial. I can then draw up the medication. Going to make sure that it has no air bubbles at this time. I'm also going to label this because it's not going to be checked by another nurse. I have the correct patient, the medication, which is hepatitis B, the dose, which is 1 milliliter, the route, IM, and the time it's going to be given. I'm now now going to prepare his insulin. I'm going to clean. Okay. And like I said, insulin, the dosage is based off of his blood glucose, which I check in his vitals as 323 milligrams. It's then compared against the sliding scale, which is going to show me that I need to draw 8 units. So, I'm once again going to pull up 8 units of air. And I can then start drawing up. And I'm going to make sure that has no bubbles in it. Because this is a high-risk medication, I'm going to do a blind check with another nurse. So nurse, I'm getting insulin for my patient George.
Okay.
There you go.
You got his vitals for me.
Mm-hmm.
Glucose is 323. Back to the sliding scale. So for 323, we will give 8 units. And we have 8 units.
Thank you. Okay. Now that I have all my medications prepared, I'm going to do another check of MAR, and this is going to include all 5 writes for all the medications. Okay. So I'm going to start with my insulin. This medication is insulin. It is scheduled for now, and the time is 8 a.m. My next medication is Hep B. I see that this is hepatitis B. It is 1 milliliter. The route is IM. And the time is active, which is now, and the time is 0800. My PO medication is correct. It's the correct medicine, the correct milligram. It's by mouth, and the time is 8 a.m., which is now, so it is active. This is my last medication, Furosemide, 20 milligrams. It's 1 tablet, PO. The time is active, and it is now 0800. Do hand hygiene, and I'm now ready to go into the patient's room and do my 3rd check of MAR.